It didn't do what it was supposed to do.
Did she not get back to you? I sent that to her. Did she
Oh,
talk?
okay. All right. I'll reach out to her.
Okay, or I'll tell her. I'll remind her again.
Okay. Thanks.
Okay.
Rosemary,
Yes. Yes.
since you've been in more of the trenches, I was going to let you comment mostly on 5C. Obviously, you can comment on
Yes.
anything, but
Sure.
I was going to let you take the lead on that one.
I'd
Okay.
be glad to. Be
Okay.
glad to. Thanks, Ron. Hello, Paula.
Good to see you guys.
Ron, did you see the email yesterday about the hacking into the Kentucky Gateway?
Yes, I made sure my wife knew about that, and
Okay,
I'm sharing it with everybody that I can.
perfect. Okay,
Thank you.
you're welcome.
Good afternoon. This is Darren with the Department of Medicaid Services. It's not quite 1 o'clock, so we'll give it just a few moments before or while we're letting our waiting room clear out before we get started. Currently, I have Ron, Paula, and Rosemary on. If I missed any other TAC members, please let me know.
Aaron, I've got 1 o'clock Eastern, and obviously we don't have a quorum.
It just now turned 1 on my end, and we are almost done clearing out the waiting room.
Okay.
I also don't see Dr. Ali on yet, so I didn't know if you want to give it, excuse me, just a, excuse me, just a moment. Grab a drink.
Yeah, definitely. Let's wait a little bit here.
Yes, sir. We'll get that waiting room clear. Sorry, I got a little choked up there.
No problem.
Meredith is coming in from the waiting room, and I believe Jill was also just admitted, so she should be coming. Oh, there she is right there. And here comes Philip. I get the waiting room cleared out, and then it fills right back up, which is a good thing. Ron, the waiting room is clear if you want to go ahead and start, and I'm going to just send a quick Teams over to Dr. Ali. She's probably meeting hopping would be my guess. So,
Okay.
oh, here she comes. I don't even have to do that. So, she is logging in, so I'll go ahead and turn it over to you.
Okay. Thank you. Okay. We'll bring this meeting to order. Thank you all for attending today. Now I think we're only missing one member of the PTAC on the meeting, so that's a good thing. I just need approval of our prior board minutes. I think I have the date right of 10/2/24. Somebody can tell me if I don't, but I always try to send those out whenever I get them back from Aaron or Kelly. So does anybody have a motion or a problem that we need to correct?
Motion to approve.
Second,
So first by Philip, second by who was that?
Matt.
Matt. Okay, we got everybody on here then.
Matt, do you
Um,
mind to turn your camera on for voting purposes, please? Thank you.
Okay. Any further discussion? All those in favor say aye.
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 Any opposed? Okay. Motion passes. I put on here under old business, if we could get an update from Dr. Ali, if there's any movement, I think it was Mr. Derringer, different ones. This for the same reasons why the SJR 26 report shows, some good statistical analysis of access to care and everything else is the reason why, we need to have community health workers uh, that are able to work with us in the pharmacy and be directed from a pharmacist. So I just wanted to get an update if anybody's on here that can give me an update on what the state's currently doing, how is it related to pharmacists and pharmacy technicians. There's certainly a lot of proof all over the country of how technicians are doing tag team technician and community health work at the same time, and having great results.
Yeah, so Ron, I'll jump in. I don't see Justin Derringer or Jonathan Scott on the participant list, unless they just joined, but unfortunately, I don't have any major updates in this space. We've been kind of shifting our attention towards the SGR 26 report, which was recently sent out for your all's read. So I think right now there are a lot of things floating in the air. One of them is SGR 26, House Bill 695, changes in some federal guidances. So, I think it's still kind of pending, and it's up there with our leadership. It's also something that altogether is dependent on some other groups within Medicaid. So, kind of some different factors that play a role there. So really no major changes in this space in terms of pharmacists as community health workers.
Because we have opportunities right now as pharmacy owners that there's some grant dollars that are available for our pharmacy technicians to become community health workers. So, I mean, usually that program's $1,500, and there's, I think 25 openings that, so we obviously want to be able to take advantage of that and put these people to good work. So anyway, thanks for the update on that. If there's, anything in the future we could do to help out that situation, please let us know, whether you want us to take care of it by statute or by regulation or by whatever. We certainly have an interest there because we've got quite a bit of technicians now throughout the state that are community health workers.
Sure.
Speaking of SJR 26, as you know, and it relates to House Bill 48 that was passed a few years back. Do you care to just, obviously, I don't expect you to read the summary or whatever, but Dr. Lee, just wanted to get your response on it first, and then I was just going to make a few comments and have some other people make comments too. And but anyway, just wanted to see if you wanted to share some information on it.
Yeah, I can talk through, kind of our vision for SGR 26. I know it was only sent out a few days ago, so some of you are probably still reading it in its entirety. And we're happy to talk through any questions that this group may have. If we need an ad hoc call, we're happy to facilitate that. But we worked with one of our vendors, Myers and Stauffer, to help us, kind of put together the content of the report. And the way that we structured it was such that we could receive testimonials from pharmacists like yourselves, who represent different areas, whether it's the independent space, the retail space, or, perhaps a little more involvement on the clinical side. So that's kind of how, we took that approach in terms of speaking to individuals who represent different organizations, receiving testimonials, not just from you, but from other states who have had pharmacists as providers, way back in the 1990s, all the way up to very recently. So we spoke to a variety of different states. We got as much feedback and information as possible. And that was kind of the premise of the report, was to take in different perspectives as much as possible. And then, from an assumptions perspective, obviously we don't know how much utilization this is going to bring to the state if, we were to open up something like this. We had discussions about systems changes, which is outlined in the report. And just kind of circling back to the assumptions piece of it, we said, okay, how many of these services are going to be a lateral shift from one provider to another. So from, let's say, a nurse practitioner or a family medicine physician over to a pharmacist. You know, if a pharmacist does a strep test, it's a lateral shift. However, services like MTM and tobacco cessation counseling are more siloed to pharmacists. With that being said, you know, we anticipated some utilization or some minor cost increases in that realm where, you know, MTM, since it's a pharmacy specific service, that's where we may anticipate some increases in cost. I think when we talk about cost, the main driver will be the systematic changes and the time that it takes to update our systems so that pharmacists can um bill for these services. Now, one thing to note is that these services will be billed on the medical side, which means, you know, collaboration with MCOs, which again, you know, requires a little more admin work, not just on our side, but on the pharmacy side and on the MCO side. So, you know, a little more, some growing pains there since pharmacies aren't billing on the medical benefit, with the exception of the DME list. So, you know, just some things there, systems set up from the pharmacy side, and all of these things are included in the report. We also alluded to emergency department visits and how pharmacies are more accessible in places, especially in counties without a standing hospital. So, you know, just kind of overall, that was the premise of the report. We tried to touch on every piece that was required by SGR 26 and really explain everything in detail. So, you know, I'm happy to answer any questions, but that was a very brief synopsis.
Yeah, I really like the report. It was very thorough. I thought, Myers and Stauffer and the DMS staff and as a Milliman or another company helped out with it. But
Yes.
the thing that on page 26, where you list the implementation timeline, I just want to make it aware to you that if there's anything that we can do to help out that situation, whether we get an ad hoc committee together that helps streamline a lot of this stuff to where, let us do the legwork or let us figure out some things. Obviously, I know your state plan amendment and different your technologies and different things. That's going to be in-house. But if there's anything else we can do, and then secondly, to point out that I know you've got Kentucky Board of Pharmacy approved protocols on here is kind of the main push, but obviously, you still got chronic care management and disease consulting, remote patient monitoring, remote therapeutic monitoring, pharmacogenetic testing, nutritional testing, still vaccination counseling, which is going to ramp up big time here in the next month and a half to 2 months. So we've got several other avenues, and then of course just regular MTM. It sure would be nice to have just direct contracts, with providers straight to Medicaid, providing those MTMs, valuable MTM services that, have shown the better educated, the more informed the patient is, the healthier they are. So I just want to leave it for right now there to see what you feel about, how y'all landed on the Kentucky Board of Protocols and also, looking into other avenues. Is that just a start and then be able to build upon that?
Yeah, I mean, we wanted to see what is already out there and what's already being utilized by pharmacists across the state. And you know, I think it was a good starting point to, you know, pinpoint the list of CPT codes that could be utilized and just kind of seeing what pharmacists are already doing. I think it provides a framework or a baseline, if you will, of kind of how to roll this out in the future if it does become legislation.
Okay. And so on our part and all of our stakeholders, then obviously we need to work with you all on the particular statute that needs to be passed. Do you think ahead that, you'll need the input from all stakeholders to get that accomplished? Or do you think you're in-house with this study and the results of the study is pretty well put it together for you? Or just want to get your input on that?
So are you talking about future legislation?
Well, I mean, you talked about having a statute passed that puts this into law to provide, for the medical service, because obviously HB 48 only, did everybody except Medicaid.
Right.
So that's why I was asking that question.
Yeah, so I think we will follow the legislative requirements as they become as they pass. And in terms of the implementation timeline and system adjustments and things that need to be made, I think it's imperative for us to have that collaboration, allow some wiggle room in terms of timeline. This is something that we haven't done in the past for pharmacists. So, just kind of mutual understanding. And I appreciate the sentiment of, if there's anything that your group can do to help the state, I think that would be helpful. Additionally, the system funds that are needed for this are obviously the dollar amount is out there. So, a lot of this is also with our leadership for further discussion. Right now, it's a report that's been published. I think everyone needs some time to kind of digest it and think about next steps.
Okay. Does
Ron,
anybody?
can I come in?
Go ahead, Jill.
Yeah, I just wanted to thank the department and Dr. Ali and everyone that worked on that report. I get the opportunity covering, 8 states to see a lot of reports, and that one was a great deep dive, very impressive. The length of it, all of the research you guys had to do to other, and contacting other states, all the conversations you had to have to put that together, the codes, just really, really beautifully done. I think it's something that's going to help pharmacy not only in Kentucky but other places, and really, kind of put the department and the team that worked on this really out there as, really outstanding research into this. So I just really wanted to say thanks.
Sure. Thank you.
Well
Appreciate
put. Did anybody else have some comments or questions concerning SJC 26 report? Okay. All right. Philip, are you still on the line?
I'm here.
Okay. I'm putting you on the spot, but you can tell me I'm just wrong. I tried to call you beforehand, but anyway,
Call. I couldn't get
Was it-
off.
that's fine. That's fine. Was it SB 50 that you had some reporting concerns, or was it another bill that we were kind of waiting on some other things, but I may be way off base too?
Is it the Senate Bill 50 update with new data? Is that what we're referring
I
to?
think that's what we're talking about.
Okay, yeah, so that is with DMS for final review. We've been kind of toggling back and forth with our vendor for that, Milliman. So it's in the final stages of review. We submitted some feedback a few weeks ago, and we just got the final version of the report. So we should have it, I would say, by the end of the month for
Okay.
pharmacists to take a look at.
Okay.
Just help jog my memory. What was the purpose of the report from Norman?
Yeah, so the Senate Bill 50 report a little different from SJR 26, is just an overview and analysis of the single MCO PBM since it went live. So originally it was sent out, I want to say last year or the year before that, with data from 2021 and 2022, I believe a little bit of 2023 as well. But now, we have some updated data. So we'll be publishing an update report. So it won't be nearly as long and in depth as the first one, but some of the narrative information is recycled, and we just put in some new data in there.
Okay. Thank you.
Should we
Okay.
expect positive
Go ahead.
things about the single PBM?
I would say that the cost of drugs are rising.
Right,
Uh,
but they would have anyway.
right. That's a fair statement. Kind of similar, and this report, it's hard to quantify and say, like, we saved X million dollars with Senate Bill 50, because there are so many factors that play a role. Again, rising cost of drugs, enhanced dispense fee under fee for service, PDL, single PDL makeup, drug mix, reimbursement. So there are lots of different factors, and kind of follows a very similar format to the original report, but just again with new data. I would say that it probably mimics what we've been seeing, but again with rising costs of drugs and just additional factors that play a role.
Does the report touch on network/access for pharmacies?
Yeah, like Ohio's did. I don't know if I'm sure you've seen Ohio's, and they were able to put a cover letter on it that really highlighted that even though the cost of drugs keeps rising, the fact that they are able to stabilize pharmacies, and have the widest network ever, most patient access. It went a long way in showcasing the study.
Yeah, so I'll double check and see if that narrative piece was carried over from the original report, but it was alluded in the first report about providers registering with the DMS network as opposed to specific MCOs. So the MCOs network might have been a little tighter, but now the network, it looks a little different. So if it's not in the second report, it's in the first.
Okay. Okay, under new business, 5C, if I'll just turn it over to Rosemary because she's been intimately involved in these discussions.
Well, first of all, I would, this doesn't really apply to Medicaid. I'd like to commend Dr. Ali and all the work that they have done on Senate Bill 50. And we see how legislative bills that are passed can be implemented and enforced. And I want to thank them for all they've done with Senate Bill 50. But turning to Senate Bill 188, that was implemented January 1st. This is August, what is today, the 13th. And we still have major portions of Senate Bill 188 that are not being enforced by Department of Insurance. And our group, KIPA, has been working with KPHA hand in hand since the beginning, since the first probably week, talking with Department of Insurance, talking to the governor's office, and recently been talking with the Attorney General's office. We've had meeting after meeting, going through the different aspects of Senate Bill 188 that are not being adhered to. I think most of you saw that KIPA and KPHA went together and got it's Catton Law Group out of Washington to submit a letter. And there was a letter about 6 weeks ago that addressed some issues, and it was sent to the governor and to the Attorney General's office and to the Department of Insurance. And then all of us have seen the bulletin that came out. Finally, we had a bulletin that came out from the Department of Insurance June 30th. And I think when I first started reading that, probably you all were the same way. I was very encouraged with the out-of-state, situation. But then as it went on to the steering portion, then I started getting less happy. And then when I read, I don't know if the rest of you agreed with me, but I read the final paragraph of that bulletin, and I thought it was very crucial what that bulletin, that final paragraph said. I think it really, if it's followed through, it could negate the whole thing of Senate Bill 188, and that's not the purpose of what we're all working to do. So we did go back to Robert Smith, who's the attorney who argued before the Supreme Court, the Rutledge whatever law or
Decision.
yeah. Thank you. I can't think what I'm trying to say. You can tell this, and he submitted a very lengthy letter in response to the Department of Insurance bulletin of June 30th. And that was sent to the governor, staff, the attorney general, to Senator Max Wise, and also to Commissioner Clark on August 1st. And still none of us, including Ben Mudd, I'm not sure if Ben's on the call, but none of us have had any response to that letter from that was presented on behalf of the pharmacy community. So we are still working every day, and we would appreciate anybody's opinion, any other help that anybody could think. What can we do? Is there anything we can do? Because we work for years to pass these laws and then they're not implemented. So that's just kind of where it stands right now as of today, this morning. So if anybody has any questions and, or any suggestions, anything we can do to work on Senate Bill 188.
Been very discouraging to say the least.
So,
Especially,
oh, sorry,
go
go
ahead. Go ahead, Dr. Lee.
Yeah, I just wanted to ask what piece of it is not implemented, if there's a certain portion, or is it as a whole?
Well, Dr. Ali, there was a major portion that was supposedly corrected June 30th. That there were ERISA plans, and I have here's stacks of some of mine. I would send in complaints, and they would come back. ERISA, self-insured, situ in another state. I have ones from Pennsylvania, from New Jersey, and DOI. Their position until June 30th was that if the plan was situated outside of the state, that they couldn't enforce Senate Bill 188. Well, they did reverse that, but the problem with that now is that they didn't give us any avenue of how to recoup the money that all of us have been out. I just ran our report for our 6 stores from January to July 30th, and I mean, I think I have over 5,000 claims that weren't paid correctly. And so no one's given us any kind of a process to how do we go back? How do we go back and rebuild these? Do we are we having to file complaints on each one of these? So that's kind of out there. But the main part were the steering portions of Senate Bill 188, and the DOI did not change their position on that. That they would that we could not enforce anti-steering positions in Senate Bill 188. But the last paragraph, have you seen this, Dr. Ali? Have you seen the bulletin? Have you had a copy?
I have not, no.
Okay, I'll send that to you
Okay, thank you.
because I'd like for you to read the last paragraph. That's very disturbing to me.
Okay.
Rosemary, will you go ahead and share that with the PTAC to make sure everybody's read that and got?
I will.
Rosemary, if you're able to share the letter that Robert Smith, the letter that you guys put in, pushing back on that, I'd love to see that.
Yes, I'll send that out to everybody on PTAC.
And anytime the chains can be helpful to you with, along with KPHA and your group, we're happy to help.
Perfect. Thank you. Perfect.
Okay. Thank you for that, Rosemary. It's been a battle for sure. Now on general discussion, rural healthcare transformation grant projects. Put this on here at the last second, and Jill wants to speak on that behalf, on the behalf of that program.
Yeah, I mean, I think, just for the benefit of the PTAC, the one big beautiful bill, had a bunch of money in it for states. There you go. Thank you. To apply for rural healthcare transformation grants. I saw that, the department did put something out. Thank you, through, I think it's called the Kentucky Rural Health Center. It's part of UK. And I just thought this really dovetails with what we're trying to do, dovetails with the timing of Senate bill, of the study on payment for clinical services, and how can I just kind of wanted to get feedback from Dr. Ali on where she thinks this could be helpful with pharmacy partnering, and perhaps it could offset some of the minor costs that the department has, in moving forward with the implementation of the findings of, of the study on payment.
Parity.
Just kind of trying to figure out where we can fit in here, because I think this is an opportunity this is a perfect opportunity for pharmacist services. In rural areas where other providers may or may not be located. And we're doing this, yeah, as we're already doing these, we already have the scope to do these services. So I'll leave it at that. Just kind of wanted to get your thoughts on how to dovetail on this.
Yeah, and I'll be honest, I don't have a direct answer today to this question. I think it's something that will require leadership's input. We do have some rural health SMEs within the department. Obviously not myself. But yeah, this is something that we'll need to take back and discuss, especially from a budgetary perspective, which I do want to just allude that SJR 26 will require those similar budgetary discussions as well.
So we should be, if pharmacy is interested in this, we should be going through the steps that are outlined in the letter to interview and apply and answer the survey, about maybe being part of the group that KY is going to put together to propose to the department, for use of those funds.
If you can get that question to me in writing, I can get it over to the right person. Again, I don't have
I think they're inviting providers to propose to make, to make a proposal that may or may not, that could become part of their joint proposal to the department. Right?
Hi.
Dr.
Yeah,
Ali,
this is Dr. Terrio. I'm sorry to cut in, Dr. Ali, but
No,
that
go
would be wonderful if you have ideas to respond to the letter. Right now, we're getting people to, getting ideas together. Even Medicaid cannot apply for those funds. The governor's office has to apply. And so this is a full-on cabinet initiative to try and get everybody together and get ideas. And we have a short turnaround time. So
Right.
that's why we want everybody's ideas and thoughts by August 31st.
Wonderful.
So,
Thanks
because
for
we have to apply
clarifying.
by the end of the year.
Yep.
Yes.
Thank you.
Thank you. Thank you, Dr. Ali.
Yep.
Dr.
thank you.
Ali, this is Erin. I've got that on the follow-up email for you.
Okay, thank you.
I know in the past, somebody from the department has mentioned needing help with like HPV vaccinations and there being kind of gaps in that. Is there any other topics that the department can think of that kind of are touch points that you guys struggle with that you could kind of throw out there to us that might be suggestions that we could grab onto and know that we could help with, and that would be good for us to know to be able to submit for these proposals?
Excellent point. Thanks, Meredith.
Dr. Terry, I don't know if you have any input off the top of your head. But that's something we might see.
HPV is still a big a
Yeah.
big push that we haven't cracked that nut yet, but that would be wonderful to keep that up. And then I can't think of anything else. Vaccines in general come to mind, but I know you guys are all working hard on that. So that's all I can think of right now.
Is fee for service paying for vaccines yet? Do we?
Yes, they are. Oh,
Okay, great. Thank you.
You know, as Ron has mentioned earlier, you know, things like chronic care management and remote patient monitoring, is that something that the department looks at or feels like there's a gap in those areas?
I don't think it hurts to include that. You know, I think the more the merrier in this situation. Dr. Terry, I don't mean to put you on the spot, but it seems like you've been working with this maybe a little more closely than I have. But you know, I would recommend that any relevant topics that come to mind should be included.
yes, I agree. It's both of those things seem to be underutilized. Is that the right way to say it? You can't have, you know, everybody needs more of that. So it's truly underutilized. So we need more people trying to get on that bandwagon.
I think we tend to focus on services. I think we're, you know, the thought is focusing on services that free up physicians' time to care for folks that are, you know, have that are ill. And for pharmacy to be able to step in and maybe do, you know, the blood pressure monitoring and, you know, diabetes counseling, those things that we can do, that we do already, just to, you know, and give the system a little bit of a break and fill in the gaps.
Okay. Does anybody have any other comments? Any other discussion today? Okay, well, thanks to everybody for being on the meeting. I think we had 100% attendance on PTAC, and thanks Dr. Ali and Aaron for your help and input, and Dr. Terriot.
Ron, if you don't mind, I have two quick updates. One about the new Mac and Back.
Yes.
As you probably are aware, due to final rule, Medicaid has established a BAC, which is a beneficiary advisory committee. So also in that final rule, we've restructured our MAC. Dr. Bobrowski on Dental Tech called it the Big Mac, which just tickles me. So now I've been calling it the Big Mac. So now we have 31 members. We're in the process of reaching out to all the BAC members, the TAC MAC members, excuse me, to start a new cadence for those meetings. Once those dates are established, we'll get them out to all the TAC chairs and everything who represent the MACs. Nothing for the TACs are changing, except for you will have a new contact moving forward. I want to introduce Barbara Wash. She's going to be taking over all the TACs. I've let her know everybody is super sweet and they're going to be very good to her while she's learning. I haven't accepted a branch manager position in long-term services and support, so I'm not leaving Medicaid. All my contacts still the same. I'm here for everybody as always, but you will have a new face kicking off your meetings next meeting.
Okay.
Hello, everyone.
Hello. And
Hi.
congratulations, Aaron, and welcome, Barbara.
Thank you.
Thank you, Ron.
Yeah. Thanks for all your hard work and putting up with my late arrival of agendas. So,
No worries. Better late than never, right?
that's right. Okay. Do I have a motion to adjourn?
So
Move.
moved.
Seconded.
Okay, I think the Meredith first, Jill second, somewhere around there. Also, any discussion? All those in favor say aye.
Aye.
Any opposed? Thank you all. Appreciate your help and attendance.
Thank you, Ron.
Have a
Thanks,
wonderful
Ron.
afternoon, everybody.
You too.
Bye-bye.